Talk Business Arkansas is brought to you by the Arkansas Farm Bureau, the Arkansas State Chamber of Commerce and Associated Industries of Arkansas, the Electric Cooperatives of Arkansas, Noble Strategies, the Arkansas Healthcare Association, and Delta Trust and Bank.
I'm joined now by Greg Hatcher. He is the founder, owner, and CEO of the Hatcher Agency, the largest independent insurance agency, health insurance agency in Arkansas. Thanks for being here.
Glad to be here.
Your industry, healthcare, health insurance, has been just a little bit in flux over the last couple of years.
Yeah.
Has that been good for business or bad for business?
Well, you know, at times we're like, is it going to be good? Is it going to be bad? It goes up and down. But I guess at the end of the day, it's probably helped a little. It's kind of like, it's helped a little in that we've probably gotten more clients. It's hurt in that everybody's confused, and so we're spending a lot of time working on that. But at the end of the day, you know, we'll be okay. I don't think anybody's worried about the insurance agents. We're worried about getting affordable cost. And I think at the end of the day, Obamacare is going to cost everybody a lot more.
Well, let's talk about the education that you're doing with clients right now, because I got to figure that that's one of the critical things. If you've got people with a lot of questions, are the answers even out there for you to even to be able to deliver them?
Yeah, that's what's made it hard. You know, they passed the law and then things started rolling out in 08, 09, 010, you know, but really they started for real in 10, and then new adjustments in 11, and then 12 and 13. The 14's a really big year.
Right.
So what happens is they pass the law, but then you have to interpret the law, and then people have a chance to write in or call in and say, hey, that's not going to work, you forgot about this, and then they have to change it. And most of the changes get done, as with most things, right at the last second before that part of the law would go into effect. So I'd say the law has been watered down some. I would say for the most part they're making good decisions when they make changes. I can't really remember any that have where they changed something from the original and made it worse. It has gotten better, but making it understandable is difficult. And then there's so many different facets of business that when you wrote the law, it'd be impossible to ever think through.
Yeah.
Like you're going to cover full-time employees. Well, what's a full-time employee?
Right.
Well, what's a temporary employee? Well, what's a seasonal employee? What's a, you know?
Yeah, and combining those different part-timers into
mm-hmm.
full-time, and you have the different employee sizes that can make a big difference in terms of what rules of the law that someone has to play under. Let's take a typical, traditional, maybe a median type client that the Hatcher Agency services. How big is that company, and what are they dealing with?
We insure groups from 2 employees to 7,000 lives, but you really can break it down into 2 groups, okay? The groups below 50 lives and the groups above 50 lives. If the groups below 50 lives right now, they are not subject to penalties. In other words, if you don't offer health care to your employees and you're above 50 employees, there's a $3,000 penalty per employee for not offering it to them. But if you're below 50, you're exempt from that. So that's the first big criteria. Are you over 50 or are you under 50? And so we work through all those definitions.
And that under 50 could be, you might have 75 part-time employees, but when you combine them somehow with their work hours, it gets you over that 50 threshold.
Yeah, business owners are smart, and so's the law. So, so a business owner would say, oh, well, we have a whole bunch of part-time employees, that doesn't count. The law would say you take the total number of hours that you paid all your people for the year, divide by 30 hours, divide by 48 weeks, and that's how many full-time employees you have. So the Walmart strategy of, hey, I'm just going to hire everybody at 29 hours and I have no full-time employees won't work, because you just divide by 30 hours and 48 weeks, and that's how many full-time employees you have to determine whether you're eligible for the penalty or not eligible for the penalty.
So let's talk about those businesses that are over the 50 full-time threshold right there. What are they dealing with?
All right, so the next step is, are they offering coverage to their employees that's considered affordable? Because as soon as you say you just have to offer coverage, somebody's going to say, okay, here's your coverage. It's a $50,000 deductible. It costs $1,000 a month. So they say that doesn't work. You have to offer coverage that does not exceed 9.5% of the family income. Well, when you say family income, immediately people are like, how do I know what my employee's family income is?
How does someone know that?
Well,
I've wondered that question myself when I've looked at the details of that law. If you employ one member of a family and there's income coming from another member of the family, how is an employer supposed to accumulate that data?
Yeah, well, this is what's kind of happened when it goes back to the law, and we say, hey, this isn't very easy to understand. So they put in a safe harbor rule that said if you'll just base it on the employee's income, not make it more than 9.5% of the employee's income, then you're safe. And so that's pretty much what all employers are doing, because it's not worth running down the family income and tax returns and dealing with all that. So as long as it does not exceed 9.5% of the employee's income, they've offered affordable coverage. That makes them free of penalty, and then the employee has the option to buy it or not buy it. If the employee does not buy it, they have their own individual mandate penalties, which is the part of the law that I think most people didn't understand. In fact, in the last debate before the election, it was never discussed because it really wasn't rolled out yet for anybody to know. Had everybody known that, the people might have voted a little differently, because one of the real shockers with health care reform is the employer who already has health insurance, he's the winner or she's the winner. The one that's the loser is the one that does not provide health care coverage for the employees, because now if they're over 50 employees, they're going to have to do it or pay the penalty. And this would include companies like Burger King and McDonald's and a lot of hourly places that just traditionally haven't had health care that have the lower paid employees. Not only do they have to offer coverage, but it has to be within 9.5% of that lower wage, or they face the penalty. And even when they offer affordable coverage, most of the time a guy making $8 an hour is not going to buy it even if it's affordable. And that wake-up call is going to occur when they file their tax return in 14, 15, and 16, and they start getting hit with penalties for not having individual health coverage.
Yeah, hold that thought. We're going to take a quick word from our sponsors here. I'm with Greg Hatcher. He's the owner and CEO of the Hatcher Agency, the largest independent health insurance agency in the state of Arkansas. I'm Roby Brock. This is Talk Business. We'll be right back.
I don't think it's going to be an easy conversation because they are very strong-willed. I think it's going to be important to us that we know that you're somewhere in a facility that looks after you, has compassion, has care, and you respect it. I mean, I'd love to look after them, I'd love to be able to take care of them, but I don't think I could. That'd be a wrong choice on my part.
Arkansas's skilled nursing and assisted living centers provide quality care for our seniors.
Farm Bureau helps protect its members in more ways than you might think. They've always been the voice of agriculture in Arkansas, working on behalf of folks like me when nobody else would. And Farm Bureau stands for the values that Arkansas families care about. They've protected my right to farm and make a living, which helps everybody who likes food on the table. You know what they say, Arkansas counts on agriculture, and agriculture counts on Farm Bureau.
The Arkansas State Chamber of Commerce and Associated Industries of Arkansas. The State Chamber AIA is the leading voice for business at the state capitol and serves as the primary business advocate on all issues affecting Arkansas employers. Our mission is to promote a pro-business, free enterprise agenda and prevent anti-business legislation, regulations, and rules. Now more than ever, business matters. Learn more at arkansasstatechamber.com.
I was looking for a bank that could best protect my finances.
That shared my passion for my business's potential.
A bank that offered investment expertise,
lending support, insurance guidance.
A bank that delivered full financial support.
That's how I found True Balance.
True Balance.
From my bank.
From my bank.
Delta Trust and Bank, the expertise to meet all your financial needs.
One of the real advantages of electric cooperatives membership is having a voice in our state's energy future.
Not a week goes by without important energy issues making headlines. These are issues that need to be discussed. And you should know that as policies are being developed, the cooperatives are looking out for our members, advocating what's best for you.
We are your friends and neighbors.
We are your local electric company.
The electric cooperatives.
We are Arkansas.
And I'm back now with Greg Hatcher. He is the CEO of the Hatcher Agency, the largest independent health insurance agency in the state of Arkansas. Thank you for being with us. All right, we were talking right before the break about this whole penalty kind of setup for employers and how it's going to start really hitting people on their 14, 15, 16 tax returns when the healthcare law goes into full effect. Do you have employers right now that are weighing the cost of health insurance coverage versus the cost of paying the penalty that they're going to be imposed on them?
You know, when the law was first passed, that was a big issue. Today I have 650 corporate accounts. Not one single one is weighing that option.
Seriously?
And not one.
Wow.
And here's why. The average premium in Arkansas is $400 an individual. Okay?
For a year, a month?
For a month. So
right.
$400 a month. So if you take $400 a month and you take 9.5% of that number, or 9.5% of 4,800, okay? Let's just kind of round that off.
To 10.
Yeah, so call it 5,000, 10% is $500 a year, okay? That's really not very much in the overall scheme of things for an employee to have to pay. But what we're finding is, as long as the employer doesn't charge the employee more than like $100 a month for individual, then they're going to pass the affordability clause even on a guy who makes $22,000 a year. So let's think of it that way. Let's take a nice round number, 20,000. 10% of 20,000 is $2,000. 2,000 divided by 12 is about $180, right? Well, it's easier to offer affordable coverage and charge them $180 in that scenario than it is to pay a $3,000 penalty, because 180 times 12 is cheaper than a $3,000 penalty. And when you offer affordable coverage, that doesn't mean you spent the money. You only spent the money if the employee buys it. When you don't offer coverage, you are paying $3,000 on every employee, and that $3,000 penalty is not tax deductible to the employer. So now it's like a $4,000 penalty. So it is always cheaper to offer them affordable coverage than it is to pay the penalty. At first, all these consultants were coming out, would it be better to pay the penalty, and it's really not. There are no cases that we have insured where it's better. Now, and that's partly because all the employers we have, we're already providing coverage like that. Now, let's say you had a 80-member group, okay? It might be cheaper if you never had health insurance coverage to technically pay the penalty, because you weren't paying anything before. You're now over 50, and the law says that you have to pay the penalty for groups over 50 after the first 30 employees.
Right.
So the first 30 are free, so that 80-member group could just say, I'm just at the right number, I don't have to pay a penalty too. But if you were offering coverage prior to the law being passed, there's no way you'll drop it, because your employees would go screaming if you took away their coverage.
Sure.
You'd pay more in the penalty. It's only the guy who didn't have coverage that might not. What we're seeing is companies like, let's say a construction company that had their salaried people insured, but they didn't have their hourly people insured. They're now adding their hourly to being offered the coverage because it's cheaper than paying the penalty.
Obviously a good thing for someone who writes health insurance policies. Is it a good thing for the employer? Does it produce a healthier workforce, or is it just another cost to doing business that you think might not be fair?
Well, what we're doing is we're telling people how they have to spend their money, is what we're really doing. And when you add more coverage with no pre-existing conditions, the real rise in the healthcare cost is not so much that we're making you offer it to everybody, is that we're now offering it with no pre-existing, with unlimited chiropractic, with unlimited mental and nervous, with unlimited alcohol and drug, with unlimited, now birth control pills are covered, for example. Unlimited everything. We're saying you got to cover everything, and you got to have no pre-existing, therefore you'll have more claims. More people getting on the plan would actually lower the cost, because you're getting the good risk and the bad risk. You know, do I think it will go up as much as everybody projects it to? No, I think people tend to, freak a little bit. Has it gone up in our rate increases 5 or 6%, but not 30%? Do I think everybody needs health care? Yeah. Am I happy about the law? If I could wave a magic wand, I'd just get rid of the law. I mean, I wouldn't. I don't think it's. I think the people that really need insurance, when they didn't have it, they may have been better off than when they have it, because they weren't having to pay a premium. They'd go to the emergency room, they'd go to the doctor, people would take care of them, and they'd write it off. Okay?
The hospitals or the healthcare providers would.
Correct. Now, from a hospital perspective, you would think this law would be better for them, and on the face it is, except to pay for the law, they've taken Medicare cuts, Medicaid cuts, okay? And the insurance companies are being thrown additional taxes on top of what they already had to pay for the money to set up the insurance exchanges, which are offering the same coverages that we already had in place at a higher rate, because now there's going to be all the real sickies are going to run into that exchange, not the people on the healthcare plan. So where on one hand it was good to put everybody together, we've got some duplication of services on the exchanges. And it really doesn't threaten our business, it just changes it.
Could you see that, though, being something that kind of gets worked out over time as people kind of understand maybe the unintended consequence of that? You see that maybe, this is something we need to adjust and move forward on.
Yeah, I think in Arkansas is kind of doing that. When they expanded Medicaid, what they basically said was, the people at this income level aren't going to be able to afford to buy on the exchange or at their health care plan, so we'll just Medicaid this level.
Right.
And
subsidizing it from the expansion money into the health insurance exchanges.
Yeah. Right. And so now the gap between Medicaid and the person that can actually afford their group health care coverage is less. There will still be some people in that gap that can't really afford it there, aren't, low enough to get Medicaid. They look at the exchange rates and they're like, I can't afford that, and they will get hit, with a fine. It's a very imperfect system.
We have got a January 1st, 2014 kind of deadline for some of this to really kick in full gear, but there are things happening before then. What's the next big deadline that business people need to keep their eye focused on?
Well, they're releasing all the time new amendments to it, and the big one is seasonal employees, look-back rules on how you calculate your full-time basis. Like, take a temporary agency. That would be like, there are some companies that would be like the worst, this would be the worst nightmare for you. A temp agency that maybe has 10 full-time employees, and then they have 1,000, temporary employees who might have worked, who knows how much they worked. Right. Last year they worked 30 hours that month, 46 hours that month, 2 hours the next month. How are we going to calculate which of those people are full-time employees? What's the definition going to be? That kind of stuff is being released and will be a big topic. The other thing is people that had management carve-out groups. A group that only did their management people, if they weren't offering them coverage on December 27th, 2012, okay, then they have to offer, if they weren't offering coverage to at least 30% of their total employees on December 27, 2012, they have to then offer those employees on January 1, 2014, or they pay a penalty even though their anniversary date might be August 1 of 14. What a lot of people don't understand is that the law goes into effect January 1 of 14 for the penalties, but not until your first anniversary date afterwards, unless you're in that scenario. So there's just a lot of small print that we got to really make sure we get through to all of our groups.
And that's what you get paid the big bucks for.
I would say that it's helped our business more, not because you have to buy health care, but because it's complicated. And therefore, if we're on it, we'll get more customers who maybe didn't have an agent who was doing that comes to us and says, hey, no longer can I do it with my fishing buddy, I got to do it with somebody who's all over it. So that's probably where we've picked up more business.
All right, Greg Hatcher with the Hatcher Agency, one of the foremost experts on health insurance care, health insurance policy in Arkansas, if not the nation. I appreciate you very much.
Thank you. Thanks for having me.
I'm Roby Brock. This is Talk Business. You can keep up with the latest business and political headlines each and every day at talkbusiness.net. We'll see you next time.
Talk Business Arkansas is brought to you by the Arkansas Farm Bureau, the Arkansas State Chamber of Commerce and Associated Industries of Arkansas, the Electric Cooperatives of Arkansas, Noble Strategies, the Arkansas Healthcare Association, and Delta Trust and Bank.